Good morning. So, once again, I'm talking about anoxic brain injuries, and this time I want to make it simple for you to understand what generally doctors talk about and how confusing they make it. Uh, I'll pick up some diagrams which I will share in some time, and along with those diagrams, I'll pick up all the terms that I can talk about. So, if I look at one of the diagrams or one of the pictures that I'll be sharing along with, it talks about certain terms, certain features that doctors use and talk and confuse anybody about. These terms are related to how they interpret or infer brain injuries as. When you meet a doctor with discussion on a brain injury, what he will talk about is something like ischemia, parenchymal vascular disruption, parenchymal dysregulation, vascular dysregulation, hematoma, tissue osmolar load, blood-brain barrier, axonal injury, vasogenic edema, neurotoxicity, astrocyte swelling, autophagy, necrophagy, apoptosis, inflammation, regeneration, free radicals. What this does is, if you are a student of biology, you may figure it out. If you're not, you will not. If you're a medical student or a physician yourself, you will find it much easier to understand. But yet, the communication for everyone is far more scary than what it needs to be and what it needs to convey. The idea here is very simple. When your doctor is talking about any of these things, or let me just talk about one more thing. Uh, he may talk about something like primary phase, secondary phase, metabolic imbalance, primary insult, secondary insult, cytotoxic changes, etc., etc., etc. When he does so, what he is talking about in very simple terms is the injury process goes through three or four conditions. One, what we call as primary insult or first injury, is the injury that happened, that was caused due to any reason, internal, external, whatever. Second, after that injury, the part got damaged, some part of it got destroyed, some is partially injured and may be recovered. All through this, there is a phase wherein, when the body is trying to recover its losses, it has those dead parts, destroyed parts being itself lying there, and it cleans it up, it eats it up, it destroys it naturally within. Through this process, a bit of fluid gets accumulated, and all through this process, during this phase, communication across different parts of the cell, different parts of the affected area gets affected, because the nature of fluid in that place changes. Uh, minerals that you eat, they become a part of your body, their concentrations in those parts differ, alter, because there is a damage physically also. There are certain exchanges that depend on variation of concentration across these structures. Those variations end up and these all get mixed up. So as a layman, you can understand that there is a total failure on communication, be it because of pressure, be it because of an electrical conductivity deficiency. This loss of communication leads to further progressive damage at that particular place or in that area, which over a certain period of time, as the body recovers, reflects in the loss of different kinds of functions. There's a second image I'll share, which, if you understand, are able to make out if a certain part of the brain or which part of the brain is affected and what particular function does that impact. Is it your smell? Is it your speech? Is it your walking? Is it your standing? Is it your hands? And is it about picking something up, or is it about being able to sense something? Any of it. When the physician says that X area and he gives it its scientific name is affected, you need not worry about that scientific name. Forget about it. Physically, what you see, the hands are affected, movement is affected, or the person is not able to sense the thing. Using this diagram or a memory of this diagram will leave you with the opportunity to pick it up and understand where and what part of the brain is affected. To make it simple, both right and left parts of the brain are mirror images. So what happens is when the left is affected, your right side of the body is affected, and when right is affected, your left side of the body is affected. Otherwise, these areas that you see on the diagram will help you understand what impact a brain injury has and why does it reflect in certain ways. Also remember, all through your life, how so long you live, there are periods for unknown reasons. You always continually develop injuries in your brain, and those injuries keep diminishing some of your physical functions. As those functions progressively get diminished with age, they reflect as part of your aging. So it is not always trauma that comes across as a brain injury which is recognizable, but also the process of aging brings across injuries that have happened just out of lifestyle, just out of bad ways of living, to show what all damages you have earned. Thank you.